Good morning.
Good morning, doctor. Good morning. How are you?
Good, good, good. How are you?
Okay.
So, welcome to our dental center.
Thank you.
You've already visited our X-ray department.
Yes.
Just to have an initial X-ray.
Yes.
And today we want to take this appointment just to kind of get to know each other a little bit.
Sure.
And of course to know what your problems are and why you're here.
Oh, absolutely, yeah.
So please, first of all, why are you here?
Be honest, I want to change my life with these dentures. I mean, I don't feel like I'm that person with a denture. Yeah.
Okay. Do you have denture in the upper and the lower?
Both, yeah,
Both.
up and lower.
Okay.
Yeah.
So maybe tell me the history on your teeth. When did you lose your teeth?
More than 10 years.
More than 10 years ago.
Yeah.
Do you have to use glue to stabilize your
Yeah, I
dentures?
use Fixodent
Okay.
every day.
Every day. From a professional standpoint, is this because you work?
Yes.
Is this comfortable for you, the dentures you have, or is this like problematic for you?
Actually, it's not like you feel like the person you want to talk with the people. I mean, it's like you feel different person. I mean, when you have dental, you're a different person. Because you try to do something and you want to talk or you want to say something, you can't. You're afraid because you feel like, oh, your teeth coming out.
Let's talk a little bit about your medical history, just so I know.
The only problem I have the dent.
Well, then, like the good news is that I have looked at the initial X-ray we have, and it seems that one of the most important things which we need for you really is the bone seems to be sufficient to place implants. What I need to do now is have a clinical exam. So I'm going to look at your mouth, look at the dentures, look at the condition of your gums, look at the condition of the bone,
Okay.
and have an overview view. Thank you so much.
Thank you.
So everything looks to be good, you know, healthy. The soft tissue looks good, the bone looks good. So now what we have to do is we have to like take that extra X-ray to really examine into the millimeter how much bone you have and if the implant surgery is going to be like possible to be done for you, which I think yes, but we're going to have to do the planning.
Okay, doctor. Thanks.
So thank you for being here today.
Thank you so much.
And
Doctor.
we'll see you next time back for the final plan.
Okay, doctor.
Okay. So welcome back.
Hi, doctor. How are you doing?
Good to see you again.
Good to see you too. How are you doing?
Good, good, good. The good news is, first of all, that your bone for the upper jaw is excellent.
Very good.
So, and that's quite almost unusual because many patients, when they wear dentures for a long time, and like 10 plus years is a long time, they lose bone as well in height as in width.
I see.
And you've lost some bone, but there's sufficient bone to place implants. Basically, we have already planned you virtually, and I'll show that to you a little bit later. Because of some of the complaints that you had last time about, you know, your problem with chewing, your taste, that the roof of the mouth, you know, doesn't give you the taste, that we're going to place 4 implants in the upper jaw. There'll be 2 more in the front and 2 more in the back. And then those 4 will be connected with a bridge immediately because your condition is so good. So what we'll do is on the day of the surgery, once the implants are in, and like we have confirmed that the position is good and the stability is good, we'll have a laboratory technician ready here. And what he will do is he will modify the denture you have, the existing denture, and then we will connect them immediately to your implants.
I see.
So on the day of the procedure, you will actually leave here with a fixed acrylic prosthesis.
Good.
It's not the final one,
No, but I mean...
but you will have something.
temporary, yeah.
Okay? And the amazing thing for you will be is that the roof of the mouth is going to be open. So you have like, you know, you can have the immediate taste.
Good.
It will be fixed to the implant, so it will not move anymore. So it'll be a completely different experience for you.
A different person.
A different person, yeah. Yeah. Okay, so like from a standpoint of post-op, it's very similar, like we discussed for the lower jaw. 4 implants will be placed, so of course there's discomfort with that. But you know, discomfort is quite minimal. Like it'd be like let's say multiple tooth extractions.
Okay.
And we'll give you again pain tablets against any kind of pain.
Same.
Food, you should also be careful. Although the upper jaw now will be fixed, so it's really going to be a different life for you, you should take soft food.
Soft food.
Yeah, because we don't want to stress the implants, too much. From a hygiene standpoint, after the procedure, it will be difficult for you to brush because there's swelling, also the sutures are there. So we'll give you a solution which you can rinse with, and that solution will keep the bacteria down.
Very good.
Within about 2 weeks after the procedure, we want you to start brushing the new implants.
Very good.
But we'll give you more instructions when you come back for the post-op visits. From a function and aesthetics, I mean, this will be functioning, I would see, as closely as your normal teeth. So
Exactly,
you should be able to eat.
Yeah.
Your wish was to eat, like, I don't know what you said, this big barbecue steak. So I'm very hopeful that this will change your life. And like really you can eat pretty much whatever you want. From an aesthetic standpoint, of course, we're going to make it look perfect for you, like, what you like. We're going to work together with you and with our restorative team to make sure that everything fits really like nicely to your desire. Yeah, you're going to look way younger, that you'll be surprised.
So they're going to be not like they come in the front like the first denture when I did.
No, it will be done like the way you wish. So we'll work very closely with you to make it really look that it will support the lips, that it will give you a nice tooth dimension, and it give you a beautiful smile.
Very good. Thanks, Doctor. Thanks.
Any questions?
It's no question. Thanks.
Okay, good. So now we'll have a look at the x-rays just so you can see what we'll do. So you can also, when you go home, you can understand what we did already for you, because we planned your case already completely on a virtual level.
To get the idea.
Yeah. Okay, now we're going to look at a three-dimensional view of the upper jaw, and we're going to use the Noble Clinician on this as well on our Apple Mac computer, so that's the nice feature. And let's move now to this first view, which is the panoramic view. And what we're noting here in the panoramic view is what we have planned is actually 4 implants for the all-on-4 treatment. And as you can see, we're using the Noble Active implant. We've planned a regular platform, a diameter by 15 millimeters in length, and quite traditional in the anterior, taking the best amount of bone with the most anterior position with a good spread between the 2 implants. And then we have moved the posterior implant as far as possible back, allowing, of course, a safety space towards the sinus wall. And in the software, we have lined out the sinus wall quite nicely here. On one side, pink, on the other side, the green. And we have allowed for an angulation of approximately 30 degrees. And this, of course, is then very easily corrected with the multi-unit abutments. The front ones, giving the bone we have, we can either go with a straight abutment or with a slight angulation of 17 degrees, which again, we can check in the software if we can use a straight or an angulated. So now let's move towards just a view here where you can see the horizontal view. And you can see that we got in this patient, because of the 30-degree angle, really a beautiful anterior-posterior spread. And you can see already that we have placed the multi-unit abutment here on the posterior, which moves us into a correct occlusal space. We have used a straight abutment on the anterior ones. And here quite nicely you can see the Noble Active. You can even see the platform switch. And you can see the correction of this particular abutment, which is bringing back the 30-degree. It's a 35-degree abutment, so it's bringing it almost back to 0. Let's have a look at the implant towards the bone. So we're going to take this scroller here and move towards the left front implant. You can see that this bone is widening out. Just check what's happening in the bottom left. And you can see right there where the implant is, we have sufficient bone to actually place the implant safe within the buccal and the palatal plate. And we have sufficient length towards the nasal floor with our 15 millimeter implant. Now let's go more back to the left side. We're going to rotate ourselves more posterior. There we go. We're just showing up here a little bit more towards the center. And now we're right there. So you can see in relationship to the implant, this is interesting, because the distance to the sinus, of course, if we would go straight in and out, would be insufficient. But because of the 30-degree tilt of the implant, we can do this quite efficiently. So I think from a planning stage standpoint, it's really excellent. So now we're moving from the panoramic workspace towards the implant workspace. And now what you will see is a more a potential to kind of, again, do our measurements. And you can also see here that we have, again, taken the alveolectomy into account, especially for the All-on-4. We have to think about what's the relationship of the implant towards the lip line as well as the lip support. So in this particular patient, again, we have done a reduction of approximately 4 millimeters. And this has been taken into account. Then we have placed the implants, as you can see, in relationship to the midline. We can measure now exactly the distance. So let's just take as an example, from the midline to the left implant is a total of 16 millimeter. And that's going to be now very interesting, because if you look here now at my surgical template, which I have, and we're looking at my radiographic template, which was used for this patient, I can now actually, when I look at the midline, I can make a reference point. And this is just an approximate, which is, of course, based on our 3D analysis here in Noble Clinician. I said that the distance between the midline and the left implant is about 16 millimeters. So you can see that I can put my probe here, and basically the first implant is going to be hitting just in the mesial cusp of the canine. So that's going to be an interesting position, which is very good from a standpoint of implant stability, as well as anterior-posterior spread. Then we're going to measure the distance from that anterior implant towards the posterior implant, and you'll see quite a beautiful distance. That is 24 millimeters. And so that would go then, and you'll see that I can exit. I will be exiting about at the first molar, which is of course great from a standpoint of function and occlusion. So that's great. We can do the same thing on the left side of the patient. So let's move and check the distance from the midline to the first implant. So that is 14.7. So that should get us also just about the same. It's maybe in between the lateral and the canine, just the mesial surface of the canine. And then the distance between the anterior left implant and the posterior is 27 millimeters, so that gets us even further back. So again, we're in the first molar position. So from a standpoint of transferring now this information, which we have planned in the CT scan, is very nice, because we can now transfer it on the surgical stent, and I'll know where to enter with my drills to really get this proper anterior-posterior spread. So the diagnostics now can be used for a very traditional type of implant surgery. Now here, features which are allowing you to have a view of the jaw, and of course we can do the traditional 3D analysis, which means we could measure the horizontal width, we could measure the vertical height, and we can see how that refers to this regular platform implant. So implant length here, you can see the 16 millimeters, sufficient for the standpoint of an implant of 15, and here the width, we got 8.8 millimeters. The only thing in this particular case, we have to be knowing that there is a slight concavity in this particular area, so our implant will come a little bit more from the palatal surface and will not go and follow the buccal surface because of this position. So overall, you can see here the benefits of this traditional approach, which is using the three-dimensional CT scan in the Noble Clinician to help us really dictate the implant position in quite a precise way. And here just one more feature which we can show, which is beautiful, because you can see the angulation which we can plan here. And of course we don't want to go more than 45 degrees, and it's probably safe to be somewhere between the 30 to 35 degrees, because that's very easily correctable with the multi-unit abutment. And that's what we basically did here. We used 30 degrees for this particular case. And here you can see how this 30-degree angle allows us to be really beautifully just anterior to the sinus wall. Now we'll look actually at the treatment which we're planned for. So here you can see in this screen here three different visions. One here on the lower part is actually the whole upper jaw. This is your upper jaw, just kind of stretched out like a flat. And these, implants have been already dropped here. And you can see how I have placed two implants in the front. They're in excellent bone. And I've placed the two implants in the back very close to the sinus, but safe from the sinus.
Good.
And I've been able to bring them actually really nice back.
Okay.
So that means they will have a lot of support for your prosthesis.
All sides.
Yeah. Oh, yeah. This is the sinus wall, okay, where the green line is.
Okay.
And the implants are just kind of in front of that, so it's very safe. You can see here that when I go from the back here and go to the front, this is the cross section. So this is the amount of bone you actually have.
Oh.
And I can show you, I'm just going forward, and you can kind of see in this level all the bone you have.
Oh.
So this is all the good bone level you have. And you can see how I've planned, when we come now to the front, here comes the implant. Boom, there it is. So we're right in the center of the implant.
Exactly.
And you can see how it's in the bone.
So that screw is good fit in that bone.
Yeah.
So I have good bone.
You have good bone, yeah. I could have measured now, or I'm measuring what the distance is between those implants.
Oh.
So in the surgery, I'll know exactly where to go. Absolutely,
It's
precise.
the right place, yeah.
Yeah. The good support will come because the implants are of a sufficient diameter. They have 4 millimeters diameter, and the length is 13 millimeters, which is excellent.
For more education programs, visit the Guide Institute at www.guidedental.com.